Hi, I am Dr. Vinay Goplani. I am a dermatologist and a founder member of Disha Skin and Laser Institute and Thane Skin Center. Today I am going to talk about a very common skin condition called as urticaria. Urticaria, also called as hives, are raised bumps which are caused by irritation in the upper layers of the skin. They can be pale or red in color and are very itchy. Hives sometimes occur with inflammation in the deeper layers of the skin, which causes swelling and can be painful. Usually hives only affect the skin, but sometimes they can be a part of a serious allergic reaction. When this happens, you may have other symptoms such as trouble in breathing, tightness in the throat, nausea, vomiting, or stomach cramps. If you think you are having a serious allergic reaction, go to an emergency room in a nearby hospital immediately. Hives show up quickly, within minutes, and fade within hours. Once faded, they leave no marks other than the scratches from itching. However, new hives may show up after the original hives have gone away. Some people may have hives that last more than 6 weeks, and these are called as chronic urticaria. There are multiple causes of hives. It can be due to an infection, as a reaction of some medicines, or due to an allergy due to a particular food. Sometimes they can be caused by allergies to particles in the air like dust and dust mites. It can also be caused by exercise, heat, cold, pressure. This is called as physical urticaria. Most people with hives do not need any testing. The diagnosis is usually based on the symptoms and a physical examination. However, tests may be recommended if hives do not resolve within 6 weeks. Skin testing for food and drug sensitivities may be recommended if there are concerns about allergies as a cause of symptoms. This is usually done in people with acute hives. Blood tests are sometimes done if hives continue for several weeks. Blood tests can tell us if there are signs of underlying disease such as thyroid problems or autoimmune diseases. Hives are treated with a combination of avoiding things that cause or worsen the hives plus the use of medications. The first treatment for hives is to figure out what is triggering the hives and then avoid that trigger. Keeping a disciplined note of daily routine in a diary can help in figuring out the triggers. The drugs which are used to control hives are called as antihistamines. There are two types of antihistamines. One is an older antihistamine which start to work quickly and work well to relieve the symptoms, but the problem with older antihistamines is that many people have bothersome side effects like drowsiness, dry mouth, double or blurred vision, or difficulty in urinating. The newer antihistaminics are better for treating hives because they have fewer side effects than the older antihistamines. Also, newer antihistamines have to be taken less often, usually once or twice per day. If your hives do not get better with these treatments, there are multiple other treatments which are available which can be discussed with your dermatologist. For more information, you can email us at disha@dishalaser.com or support@thaneskincenter.com. Take care. Stay safe.